Hi, and welcome to Skincare by Sydney. I'm Sydney. I'm a dermatology PA and your guide to skincare. Today, we are actually talking about in-office treatments. So I'm going to give you a brief overview from the most superficial to the deepest, literally into the dermis. So these are going to be mainly treatments that are done by an esthetician, and then sometimes as we get into some of the deeper lasers, it depends on state law. It's either an MD or DO or sometimes PA and MP depending on the state. So if you've never been to the esthetician, what I recommend is starting with dermaplaning. This is going to remove the stratum corneum, the outermost layer of our epidermis, and that is the dead skin cell layer. So you're gonna see improvement just in the overall appearance of your skin, and it's gonna make your products work better because they don't have to go through that dead skin cell layer. This is something that is safe in pregnancy because it's literally just shaving the skin. It's also going to be the cheapest, so I think it's just a great place to start. Estheticians are so important. I love working closely with them and creating skincare routines and treatment plans. So usually you can get something done, a treatment done to your skin every 4 weeks or every 4 to 6 weeks. And if you can afford it and you have the time, then I think it's great to find a trusted esthetician and just plan on visiting them every 4 to 6 weeks. So some other treatments that you can also have by an esthetician is microdermabrasion and chemical peels. So microdermabrasion, it used to use crystals. It actually just now uses like a crystal tip and then a vacuum suction. So it's a great exfoliation for the skin, as is dermaplaning. There is something called hydrofacial, and there's also diamond glow, which actually will infuse serums while you are having the microdermabrasion done. So sometimes these treatments can actually get pretty expensive. Whenever we're talking about microdermabrasion chemical peels, typically a package of 2 to 3 is considered a complete treatment. Chemical peels are an entire story on their own. There are extremely superficial ones that you get on purpose before an event because it makes your skin radiant. We call them like red carpet peels. Then there are some that can go super deep and you can for real peel for a long time. So estheticians analyze your skin, and knowing your goals can help guide you through that process. There are 2 treatments that I think that everybody should be doing if you're like 25 to 30 onward. And this is where there's a lot of science, a lot of medical research that proves that these are preventive. And these 2 treatments just don't always get talked about. And so that was one of the reasons I wanted to start Skincare by Sydney, is because I'm like, I have this knowledge and there's not a great outlet for it because you don't talk a lot about like anti-aging or aging gracefully prevention, although a lot of these treatments will just help with sun damage. And so there is some evidence that they can decrease your risk for having like some precancerous lesions. Insurance is never gonna pay for them, but microneedling and BBL are something that we all need to be doing. And so there are so many great treatments, but like I said, we can get these done typically about once per month. So we do have 12 options to get them throughout the year, but time just will fly by. And so typically we are constrained by time and then budget. And microneedling and BBL are going to be about $300 per treatment. And so most people need at least 2 per year. And then if we're trying to correct, typically that means we're a little bit older, maybe 40s, 50s, 60s, then we need to do them more often. So microneedling and BBL are the bridge between like the aesthetics world and then into the like medical laser world. That extends all the way up until like surgery. So let's talk about it. 2 things that happen from the sun that cause aging: we get fine lines and wrinkles, and then we also get discoloration. And so I think of lasers as helping more with discoloration on the skin, and then microneedling is going to help more with texture, fine lines, wrinkles. We use it a lot for acne scarring. So what microneedling does is it actually is a device that has needles. It does puncture the skin, and we create controlled micro injuries. And we can control the depth based off where we are on the face. And so this treatment is from where I've seen it, pretty much always done by an esthetician. You're gonna find it in an office, like a plastic surgery office, a med spa, if you have a cosmetic dermatology office, and sometimes even gynecology offices will have a med spa attached. So the reason that it is like the treatment for everyone is that it has minimal downtime. It's really about 3 days, maybe up to 5, but really just like 2 of not being able to sweat and not wear makeup. A little bit red after, but you can totally go out in the world and people don't really stare at you. It's also relatively inexpensive in this world of treatments. So about $300. And it is going to help with everything: acne, scarring, sun damage, hyperpigmentation. It prevents fine lines and wrinkles, and will also treat. What it does is when we damage the skin, our body will heal itself, and in that process, it produces collagen. And so that is the main source of anything that says anti-aging on it. It all has to do with collagen. So we are going to get some collagen induction in our skincare products, mainly with like peptides and growth factors, but microneedling is invasive. It's really, really important. If you're getting Botox, you should be getting microneedling. And that is my very, very strong opinion, because we're getting Botox to fix like fine lines, wrinkles, some unevenness with movement, but we really need to go to the source of it as well. And so that is what microneedling does. BBL, it is a laser that uses light and it attaches to pigment, and so it will attach to brown pigmentation. If you have brown pigment, you're going to have downtime. The brown spots will get darker and then they will slough off. But the evidence that we have is that if you will do this twice per year, it'll actually treat that sun damage that's under the skin, so that these brown spots or liver spots don't come to the surface. And so it's called Forever Young BBL. And so I recommend that we are at least getting 1 to 2 per year in our 30s, 40s. Really twice per year is what's recommended. Again, if we are trying to improve something with BBL or microneedling, then we're going to do at least a package of 3 treatments. So next up, there on the collagen route, there is something called halo laser, which actually combines a laser that helps with pigmentation and microneedling, but not through needles, actually through laser energy. So BBL, we do not use for melasma. Halo can be used for melasma, which also means it can be used on darker skin tones. And there are also 2 other types of treatments. One is called radio frequency, and there's also oil therapy, which is an ultrasound technology, basically having to do with heat to stimulate collagen production in the dermis. So these are kind of like adjunct treatments. Then from there, we are just in the ablative laser world. They're ablative laser, meaning that it is going deeper. It's going into the dermis, and so you're going to get more benefit. You're going to have more downtime. It's going to be more expensive, but this is where sometimes up to 2 weeks of looking extremely rough, and these can be done in office all the way and going to the OR. So there are so many different lasers that are going to fit in this category. CO2, a lot of these are fractional lasers, micro laser pill, pro-fractional. So kind of like the large category is ablative lasers. So we have dermaplaning, kind of think as microneedling is like the bridge into more of the in-depth anti-aging world. And then we go onward from there into going basically just deeper and deeper. I always recommend getting a consult for any of these. So, we can talk about prices and downtime, but really that needs to be discussed with the person that is going to be doing the treatment. So I hope this has been helpful. It is truly important to invest in in-office treatments. and I love skincare, but one of the reasons that I am an advocate for creating a custom skincare routine that fits your skin and your goals, but also your budget, is that we really need to focus on in-office treatments, especially late 30s, 40s, and sometimes we just can't have all medical grade skincare and do these in-office treatments. And so the hierarchy of importance is going to be a basic skincare routine that's for your skin type, that has a retinoid, a vitamin C serum, and sunscreen daily. And then from there, in-office treatments, and then we can kind of go back and talk about our cleansers and moisturizers and eye creams and how this all needs to fit together, because we are in this for the long haul. So I hope this has been helpful. Sometimes I feel like this is just kind of like a brain dump, but my goal is for it to be informative, and then you can contact your local med spa or plastic surgery office or dermatology office and discuss what is best for your skin with your provider. So I hope to see you next time, and if you want to see more videos like this, please subscribe below. Thank you so much.